Clear communication and effective team working between different healthcare workers from different professional groups is essential for delivering safe care for patients. In many countries, healthcare is becoming more and more specialised, and clear communication within the multidisciplinary team is vital to ensure there is clarity of roles and responsibilities, procedures and outcomes. Time and time again, research has shown that ineffective communication and poor team working has been a major cause of an adverse event and heightens the risks to patients.
It's Campbell, Duncan Campbell. I mean, it should be there. There's no question it should be there. I'm sorry, I'm just a bit pushed for time, that's all. Definitely running right now, that's it. Sister, has Mrs. Hughes arrived yet?
Yes, she is. Just settling in now.
Great. Look, would you check this methotrexate with me, please?
Sure.
Thanks a lot. Can I borrow your pen?
Okay.
I've left mine in pharmacy. There we go. Thanks a lot. Look, would you put this in the fridge for me while I go and deal with this? Thanks a lot.
In the film, it should be obvious that these two terse exchanges and communication breakdowns contributed to the error. It is not just verbal communication that can be at the heart of serious error. These professionals are not working effectively as part of a multi-professional team. They're not respecting each other's roles and responsibilities and supporting each other in delivering a common goal, the safe and effective care of their patients. As you can see, without verbal handover, the written note had no context. In the midst of a complex and stressful situation, important messages that should have been clearly communicated between staff were lost. The lack of effective staff handovers and lack of clarity in individual roles gives opportunities for misunderstandings to arise. Communication can be aided hugely just by stepping aside into a quiet spot, even if only briefly. Staff need to have mutual respect for each other's role and professionalism. They need to be able to respect and value constructive questioning and deal honestly with misunderstandings. A hierarchical structure and a culture where junior staff are afraid to speak up and effectively challenge or query the decision-making of senior staff can contribute to poor team working and the resulting poor communication. Environmental factors such as stress caused by understaffing and overwork also play a part. An appreciation of the cultural differences is a key skill for successful communication in our multicultural world. This is particularly important in healthcare, especially when workers and patients may be from different cultural or socio-economic backgrounds, making some of the sensitive aspects of health difficult to address. Differences in language, customs and conventions, and even religion all have the potential to lead to poor communication and misunderstandings. Some organisations still have a culture where respectful dialogue and inquiry is not encouraged. We need to move away from this to a culture which requires open and honest communication between all players in the healthcare setting. Handover and clear documentation need to be actively encouraged and promoted. Effective teamwork needs to be encouraged. For your organisation, ask yourself the following questions. To what extent in your healthcare setting have you addressed the need to have effective, multidisciplinary communication? Do staff value or even know about each other's roles? Can junior staff approach senior staff and make a legitimate inquiry about the safety of a situation? And finally, do you work well as a team?
Correct labelling, storage and dispensing of medicines is vital to protect the patient against potentially lethal harm. Medication errors in some studies have accounted for up to 30% of medical errors. Safety of medication delivery is thus one of the most pressing issues of the patient safety agenda. In the film, almost everything that could have gone wrong with Jane's medication delivery did go wrong. This chain of events started long before she was administered the wrong drug. Standard operating procedures and guidelines to prevent Vinkristīna being stored with the methotrexate should have been adhered to.
You must be Dr. Robinson. Thanks very much.
Dr. Robinson and Dr. Campbell had never met before. They did not have specific training to be checking these drugs. It should have been the certified nurse that was involved at this level. Traditionally, healthcare workers have worried mainly about the issues of adverse drug reactions, where the patient has been given the right drug but suffers from a side effect. A separate area which concerns itself with ensuring the right standard operating procedures and guidelines are being followed and the right dispensing and delivery systems are being used is known as medication safety practice. This is an important area which examines healthcare systems to try to prevent errors such as that in the film. We all know how bad a doctor's handwriting can be. Yet sometimes the medical notes are the only way that healthcare professionals have to communicate with each other. Therefore, medical records need to be clear and unambiguous. They need to provide an accurate way of conveying important actionable information. It is essential that all hospitals, clinics and treatment centres have established policies for ensuring medication safety. In general, whether we are dealing with Vinkristīna or not, there are certain principles that you may want to consider. For example, all drugs must be clearly labelled and labels must be easily visible. Drugs must be properly checked by the designated person against the patient's medical records and the drug chart. And for high-risk treatments like chemotherapy, drugs must only be given by nurses and doctors with specialised registered training. For your organisation, ask yourself the following questions. Are medical notes easily accessible, kept regularly up to date and easily legible? Do your procurement policies ensure consistency of drug purchasing and checking mechanisms to detect potential errors such as look-alike and sound-alike medications? And finally, do you have systems in place to ensure only those properly trained are able to be involved in the delivery of high-risk drugs?